Hidden in the heart of the Himalayas, a small kingdom defies conventional wisdom. Bhutan, a nation guided by the philosophy of cross-national happiness, has embarked on a remarkable journey, a journey that places the well-being of its people at the forefront. Here, healthcare is not a privilege, it is a right. Enshrined in its constitution, Article 9 mandates free access to quality public health care for every citizen. Before modern medicine, Bhutan relied heavily on spiritual practices for healing. Astrology, Buddhism, and traditional rituals were used to diagnose, predict, and treat illnesses. Astrologers interpreted celestial signs, while born shamans performed rituals to drive away evil spirits. Local healing traditions were passed down through families for generations. Traditional Bhutanese medicine, known as Sowa Rigpa, dates back to the 17th century after the arrival of Shabdrung in 1616. It was during that time a few Bhutanese traveled to Tibet to study medicine, laying the foundation for the country's traditional medical practices. Traditional medicine was introduced as a part of the national healthcare system in 1968 under the royal command of His late Majesty Jimmy Dorji Wangchuck, the third King of Bhutan. The Faculty of Traditional Medicine was established in 1971 as an indigenous training center at Dishanchuling, Thimphu. As per the resolution of the 32nd National Assembly, 8 students were recruited to undergo 3 years member training. The training program for Dunso was started in 1978 following a royal command of His Majesty the 4th Duke Gelpo. The training center was upgraded as the National Institute of Traditional Medicine in 1992 and shifted to the present site in Kawajansa, Thimphu. Today, the institute functions as a member faculty of traditional medicine under the University of Medical Sciences of Bhutan.
Tengachigi nalu na kachulo nepdisulu menju pyutangi hampamado leshara yu seshuni tete kachara moso rochibachin jamjegi menje se mechpinula jamjegi menje se medi tete chubani lamdubni tetelen ngacharani massage sela memu chupa ani benedisu in seshunela tedele da subjegi menje de kachimo sawachin khap jamni mi jamni tha chani disu in seshuni tete zumbera ngache kamkhap gi menje se te kamkhap gi shabdo di karagi khenda khenjim bai mula acupuncture sela me yondalu and the lady zumbera tedele lenga gi shabdo se tengachara neptisu TV gi nasana mesame shu cheta yumedesu awasha digi be chota beni pekengi nasana mesame shu cheta yumedesu khale chu digi be chota beni laso begi chota betang mado hampanga lenga seudalu titigulu lenga ingin rundum cheke odalu tube te tige macheba te telenga cheka chi labdo chibo chin ta sem kham da devegi nasa te ta sem kham sodalu te ta sem kham gi nasa theribari thokopti mindobala tenga chara ta tarina ba ta tigi juro da tindigi be kara mate makhombe ngale te sem chap chup ta ni loma chobe anebe be misugi tulu tenga chegi sori shine da lujongi shabdobe te tizumi gi shabdo hampa mado pha gebachin te telen khechi dunde chi se shunela.
Traditional medicine services are integrated in all district hospitals and primary healthcare units, complementing modern medicine. This unique approach to healthcare is truly unique to Bhutan. Bhutan's modern medicine journey began in the early 20th century during the reign of the first king. By the time of the second king's reign, we had around 7 medics in total, including doctors, compounders, and a veterinarian. These early pioneers were the product of the first king's far-sighted vision and the dividend of his investment by setting up the first formal school in Ha in 1914. When Bhutan's planned socio-economic development program kicked off in 1961, the country had just 2 hospitals, one in Thimphu and another in Samtse, and 11 dispensaries scattered across the nation. These facilities were staffed primarily by foreign doctors and nurses, with only a handful of Bhutanese medical and paramedical personnel. To address this shortage, several Bhutanese were trained as paramedics in India and are posted to various dispensaries. In the early 1970s, a handful of Bhutanese received the Colombo Plan scholarships to study nursing abroad. Upon their return, they brought a wealth of knowledge and experience to our healthcare system.
So when I started in February 1976, of course, there were very few, in fact, hardly any Bhutanese doctors. Mainly, we had a lot of doctors from Assam, India, and similarly, all the staff nurses were mainly from India, South India, and some Assamese sisters were there. So just the junior nurses were like the assistant nurses which have been trained here, they were there. So it was, especially, we having trained abroad, they had different facilities, so it was a big challenge for us to, get used to. When we were in our training time, everything was there, the disposable. If supposing to put an intravenous drip to a patient, it all came, pre-sterilized in packs where you just open it. And when it got here, I had to really struggle because it was all rubber tubes, which you had to, after each patient, you'd have to boil in a sterilizer. And then there were these little glass things where where the IV drips. It's a glass, then you have to fit that together. And the worst was the needles there. Now the needles come, disposable needles. Those days we had those reusable needles, the steel needles. So quite often to sharpen, we had to sharpen the needles on a stone. You didn't experience that. We had to sharpen the needles because those needles will be used even for regular injections. So all it was a totally, we came to a totally, I think there's plus points and minus points of, training in a developed country. Was there, everything is there and you're not prepared for this, And when you come back, suddenly you have to put up with all this. So those were challenging times.
Yeah. And for me, what was difficult was when we were training as nurses in England, we were there as caregivers. So basically we were giving care to the patient. So we did everything for the patient, bathing them, doing everything, even their toilet, everything we did. As nurses, we did everything. And giving IV, intravenous, we were not allowed to touch because that had to be done by a doctor. When we came back and we had to do, we were, in the hospital, suddenly we realized that we didn't have to do patient care, we didn't have to do the bedpan, we didn't have to do things like that. But we had to do the doctor's work, where we had to give the IVs, where we had to take sometimes the decisions what the doctors were taking, So that was very difficult for us.
A pivotal moment arrived in 1974 with the establishment of the Royal Institute of Health Sciences. These institutes trained Bhutanese healthcare workers, becoming the foundation of the healthcare system. RIHS fostered self-sufficiency in healthcare workers, though medical doctors were still primarily trained in neighboring countries. Another significant milestone in Bhutan's health history was its joining of the World Health Organization (WHO) in 1982. Since then, WHO has been a steadfast partner, providing support in a wide range of areas, including technical expertise, capacity building for Bhutan's healthcare workers, assistance during health emergencies, and strengthening the overall health system. Currently, WHO and the Ministry of Health have joined forces to tackle the rising challenge of non-communicable diseases.
We are working very closely with the ministry to develop a multi-sectoral action plan, and also to promote physical activity. WHO has provided open gym equipment in all the public places, in all the districts. And last year we provided 43 gym equipment to monastic bodies, because we found that in the monastic bodies people are not exercising enough, they are not able to go and exercise. So we provided them open gym equipment within their periphery. And we are also repairing some of the old equipment which are broken. We are also repairing those, so that common citizen, common people, they're able to make use of those gym equipment and do some exercise closer to their home. Apart from that, we are also promoting Sowa Rigpa in all the districts, where we have now trained people in how to do Sowa Rigpa. So we have trained our school health coordinators, and we have reached out to all the districts and including the village health workers also, to that level that these things are important, and we are reaching out to them with the health advocacy on not to have tobacco, not to give up or reduce at least consumption of alcohol, reduce the consumption of salt, reduce the consumption of sugar, have adequate vegetables and fruits, and keep yourself healthy, adopt a healthy lifestyle. So we have reached out to all the village health workers, to all the communities through these networks.
Bhutan's commitment to public health is evident in its long-standing vaccination program. Established in 1979, the Vaccine Preventable Disease Program, formerly known as the Expanded Program on Immunization, has been a cornerstone in safeguarding the nation's health. This program has played a vital role in protecting both children and adults from vaccine-preventable diseases for over many decades. Immunization is one of the most cost-effective public health interventions in reducing disability, morbidity, and mortality. Initially, the program introduced 6 antigens for major diseases including tuberculosis, diphtheria, pertussis, tetanus, polio, and measles. From the National Immunization Policy Statement, the Royal Government of Bhutan shall maintain above 90% immunization coverage at all times. The overall immunization coverage for the country for the year 2023 was 98.6%, and the coverage has progressively increased over the years, with only 41% in 1985. Currently, we have 13 antigens including HPV and influenza in the country. Bhutan's strong commitment to vaccination led to significant achievements. In 1991, the country received recognition for universal child immunization. This was followed by a polio-free certificate in 2014, maternal and neonatal tetanus elimination in 2016, and most recently, the elimination of measles and rubella in 2017 and 2023. To ensure the sustainability of Bhutan's free healthcare system, the Bhutan Health Trust Fund was established in 1998 under the guidance of the fourth king.
Health was always His Majesty's priority. And when we propose to His Majesty, when His Majesty was running the government still, that we cannot sustain health, Your Majesty, let's put a price tag. Let's have user fee. He says, no, absolutely no. I must keep health free for our people. You all have to find way of sustaining it, but we have to keep it free. And that's how the birth of the Health Trust Fund came about.
In 2013, Bhutan took a leap in healthcare education by establishing the Gesar-Gyabo University of Medical Sciences. This university was founded to address the nation's growing need for skilled healthcare professionals and to elevate the quality of healthcare services. A major milestone was reached in 2023 with the university launching the MBBS program, aiming to produce highly qualified medical doctors to strengthen the healthcare system. This signifies Bhutan's commitment to investing in medical education and training for a stronger, more sustainable healthcare future. Today, the health system boasts 55 hospitals, 187 primary healthcare units, 51 sub-posts, and a staggering 557 outreach clinics, ensuring healthcare reaches remote areas. With approximately 7,000 health professionals serving a population of over 700,000, Bhutan has a ratio of about 0.01 healthcare professionals per person. The majority of healthcare professionals in Bhutan are nurses and health assistants, which indicates a focus on primary care and public health.
The primary health centers ki primary role in disease prevention and health promotion the nale shabtu kachira thopchu zawajin preventive health services like family planning mula zatsang charji gi shabtu thopchu the ANC selape antenatal care amsusu rangisuka alu di chajim kale alu makyo chense gi banalu alu di gade bidazi begobina rangizu gade bidazi begobina min gazum zagobina takche chagadim chi begobina ani hijabto ya topsula tele delivery alu su na men khana bikini hijabto ya phido taro PNC se mola postnatal care alu di ke chajim nale hapta du malam chense alu di zu gade be rindoka nyam gade be jadoka jaundice che thopdoka mathopdoka ani hijabto che phidola Tedaro immunization se la alu khap jamni ki alu dikishim le loni malam sense khap gi jab to suya nale pidola tedaro service with care and compassion se mola nip chu dadi nip shubi nadi mi agida ange lam juma chuba meka na hema chuba yimi chu gi denle ngachi gi be khonu shab to di khungi chimna jobe pidola There form 3 drugs se hemabachin form 3 drugs di menkana lemba hospitals menka bommula analu lemba jogula midisu khora gibe te tadarina ba bewachin di misu khora jomongo be ngachi gibe ma hospitals na le lenbe na PHC libe temple bedola
The limited number of general specialists and subspecialists could impact access to specialized care. This imbalance highlights the need for increased investment in training and retaining healthcare professionals, especially in specialized fields.
데 다르나바 배우시는 가지기 랭카다 레디 신준배 마저기 소안나루야 데 롱아이 차르지 주순바디 데 계신게베 쌈디 데 디날루 데 두데 카 듄디지기 톨루 시작되기베 데가 저기 소안나루 소와 다 트든 야르파르기 된래 처지가 되베 쌈니나 데다 치디기베 네릭디소 깍탑기 된래 탑주 르바 데다 치디기베 다르나바 숲잡에 튄디유미 본인님이 배 내지디스에 가되베 깍탑 베니나 델레 멘체나루 캐릭디수 자케 가되베 땅니나 데 디수가랑 아치기 차싱타업에 주디 유시슈니 데 델렌 가치르기 갸캅나루 고베기 미톱 말람비기 깡엘디스에 센디기 된레 탑시 디데리 게디기 카툴레 쭉데디수 주디 가치르기 슝기 카툴레 데 쭉라 롭데 나루 데 시엔기 롭정디수가 되베 자켓단에 디수에 큐드레 유시슈니.
In the recent years, Bhutan has introduced various specialized medical services, including heart procedures, organ transplants, joint replacements, and surgeries for liver, kidney, and brain conditions. These advancements, often facilitated by regional collaborations, have significantly improved the quality of healthcare for Bhutanese citizens. Similarly, Bhutan is also actively striving to expand its healthcare infrastructure. A 150-bedded Gelsen Jetsen Pema Wanchu Mother and Child Hospital now offers comprehensive care for mothers, newborns, children, and women. Additionally, the first cardiac catheterization laboratory has opened, reducing the need for referrals and enabling timely heart treatments.
Zedo dinamse sebiongla de tangba zedo sebiong junglu de le miselu pentonime tangba de time namasame ma heart ki case ki bewachin namasame ro emergency lu tumi mala de kadem chibero time na mahebachin midi de fertility 99% or 100% ime wala so time na hego ni namsame khachini and when na dulu the machine anzumbe da theum da de machi karatim gaila anzum pentonimela.
Construction is underway for a new mother and child hospital in Mongar and the 60-bedded Pema Center for Mental Health. Advanced diagnostic services like CT scans and MRIs are being installed in various hospitals. Basic laboratory services and imaging techniques are now widely available in hospitals with 10 beds or more. Today, Bhutan's healthcare system is embracing technologies to enhance service delivery and accessibility. Initiatives like electronic health records are integrated in 48 hospitals, and cross-consultation across medical professionals are done through telemedicine. Telemedicine uses digital tools like video calls and mobile apps to provide remote healthcare, enabling patients to consult doctors without visiting a clinic. Remote monitoring, such as cardiotocography, a sensor device to monitor the health of the mother and fetus via mobile apps, are also installed in most of the primary healthcare units.
The specialized health camps in Bhutan, Anibodalu, Gadichibe, Nipti, the
kechusu da cheba lunchu men kana be washin the ni la ngachigi urology services lo dele pumo su ni gi lo dele gechigi shakche be ni su mi bala ani mibdalu ngachigi na lebe ngachi na jedile desinchi zobe paju dele shakche be de biru gachi be pa be de pagi shachu mongol zum be ochin na le shachu ju ochin de shachu gi mi su na o mongo be shakche gi lerim zo du yula an zum be ngachigi te lunchu men ka kati sanalu de specialized services de ngachi be ochin specialized camp for the unreached populations de ania bedra use shuni
Bhutan's healthcare system is currently grappling with the significant challenge, the rising prevalence of non-communicable diseases, as highlighted in the National Health Survey Report 2023. Major public health concerns include hypertension, diabetes, cancer, dental caries, alcohol-related liver diseases, mental health issues, and stroke. NCDs are estimated to account for 73% of deaths in Bhutan.
Anzu mabugi neji dolendi da lochi rusis be se shunila. Da ani da ngacha kadam chabra chapko da ani chabni tenlu. Da ngachi hole ka chushudira da screening se. Sachi kara ejip chaptigi. Ka semedi sede denbe yoga tashu. Ka semedi gesuga ka semedi datu ya men sagmagobi dunkana denuga anskara Egypt nibe the tare ngache in the chuchibi tari chujilo the World Diabetes Day the myonga der mbochi dugel jibagi chunkar titingi the hapthai the anolu ngache nationwide gelong nalu the Egypt japnila tashuda the le chinigi nejidi ani ngache ta geka 용루베 데 미레레신도 로초게 아탑디 당시 에십 구투니 있어라.
While Bhutanese citizens are undeniably grateful for the government's commitment to providing free health care, some have expressed concerns about the current state of health services.
Mekanadi Teteraoni, the Lishim Mindus Sedishunimi, and Lishim Dido, the Tetekap the doctor the Chimatsova, Halam Gugop Teme, the Langatim Chikina, the Nimini Sumsume, and the Ongop Temela, the Tetekap de Lina Gudeguma, the Lina Gudebe, the last Nalo de Methovela.
The liner de remit on Babenom, the liner de Super Diogo Menalata, ringote mangova to be essentially Machema she Kalama de Tom Turutukove, Nele, good Dukove, Tana, Temna, Matava, Chinting, a Jaro Shinero, then I do get Kamna, the Tenga, Rimbuchi, upset to the Kudoti Maggie. The Major Miramonde, Tarime, Matana, Bachine, do Mapale, Menju, chapter the top of the essentially.
Mapa Junkarin Chini, Menkanaka Ufokamni, ni Japta to Matutum Nangla, ni Junjela, ni Uma, Junga de Gipogi, Utsini, Yapsebak, Tamchingirang, Ta, I Uto Misirbakan, Amisami, Jampate was ni Japta to Lipunangla, ni Junjela, ni Dakpakam ni Mapa Tamchirang Mangi, ni Ture, Nixere, Uto Hanang Le Pion Baki, ni I mean Yamchungdang Unuga, Ewa the Dasurchi, ni Dena, Junjamiram, Hang Pamni, ni. 아이가 제방길라 릭보니 숭라 제방길라 다수로 항 안에 부자냠 장딘데 말라 준절라 니 엄청 은혜 줄라감니 투까 만남죠 탐치랑 탐지기랑 망기 투르당 닉승기 니 잔잔 아니 알루 말라 준절라 에와치니 다수도 데나 니 멘강가 운이부 니 잡투르랑 제방길라 통마랑 나미삼이 소다피니 니 랑다부 미냠충가 냠게 ni noangi turlikpo ani yeganela aibuni sangmagi pasim adikela shonang pinchona nyalki chota phila kalra aibu namsam semshini ni utu hanan dena junchela
te nagir namsami tubela te narte ganye to mo jala shukije de mo te men sar kanber check chabrula te namsami te ngachina hayu sirna shabto matu tubbe nom
Gadin jingam da we gel kabi Kaki pin sum so be gel kabi Miwarim jinsu gi ngawolu Machi du mi kewa
ngachira tatu sunsugi bana Rumi sunam jindisu miwarim jindisu gi kudan jumale tendigbe ngachiregi soege shabtu disu masang sambe nerim chungwale chewa sunsugi bana dilea matseba gyakab chikaluye soege shabtu juwa rime tongbabe nangda nangshimbayi te tatu sunse ngachiregi shabtu topdu zumbera te ngachira shabtu di shudira degobachin ngache dumi tsugi katule bede beru dilu ngelin bedigibe ngacheragi rangi sudi rangi dagzin bedigibe lujong beni la sokpa mengangi dungsu disugi kalob disulu nyendigibe te ngachege khasung begopta zerik panglangi nerim disuda tidigibe zebachin tele ngachera tsora neji nyumdara te ngacheragi zedu disu nyumbe beganle te rimi tongbagi shabdo ditsuya yundenbe kepa matongi badu neni imbesi shuni te debole tendigibe dumi chidung chungsum garigi te dalepa beru rangachigi shungi namigi suwege shabdo rimi tongbabe namidi dilu melam lejimbe tabdigibe dalepa sowa lenkagi lalen tabdigibe godin tabdigi yubegi lerim ditsunule chama to nandigibe jabcho pinangasi shuni
From its humble beginnings, Bhutan has achieved remarkable progress in healthcare through visionary leadership, well-crafted policies, and unwavering political commitment. This holistic approach ensures that no individual, regardless of their social standing, is left behind. Bhutan's journey inspires, demonstrating that a small nation can achieve extraordinary feats in healthcare by prioritizing the well-being of its people. It is a testament to the power of compassion, innovation, and dedication to the health and happiness of its citizens.